think we've communicated this one. The recent release, I think it was there. It's 250. That's the number that we gave to pharmacy and pharmacy technicians. But as we also provided additional information that when we are doing the prioritization also, we gave the technicians 150 and then we gave the pharmacists 100. For the recruitment process, it's not ending. As I just said, that Honorable is still pushing for us to get another current before the end of the year. So pharmacists will be considered. I think what we have planned to do is consistently, whatever you get, you ensure that all professionals are considered. That is our objective. So that one will not change. I think minister have been saying that even if you get one, he will share for everybody to get some form of it. So that's what we are going to do. And I think I want to add something to what someone asked about the NAC. So we appreciate that the NAC, their numbers were very few. But as I said, this particular recruitment, the objective was for free primary health care. So that's why even usually you realize that registered general nurses, they will have the highest number. But at this point in time, certificate community health nurses got the highest. So it was because of the objective. It's the objective that is driving the numbers that we are picking. But I'm discussing with Ghana Health Service and then chat to see whether the slot that we have remaining, whether we can reprioritize them for the NAC. Because I actually thought also, I also felt that because their numbers are huge and they were not getting a lot of slots.
I'm not sure all journalists have work. Why are we training accountants? I'm not sure they all have work. Education is to liberate you from ignorance. That is the first reason. And then the second one is to get you a job. We have not said that we are not going to recruit nurses. We said we'll recruit them as and when we get financial clearance. So we have to continuously train. The other question, I remember the Honorable Minister saying that the volunteers will start from 2022. Nothing has changed. It will still start from 2022. The 2021 batch who were not able to get this particular slot, the next clearance will be part of it. So it's from 2022 and not 2021. So it's still, the plan still stands.
One thing I'll say is that there's no way anybody can do double registration. So every applicant has got a very unique reference number. And when you apply to a specific district, it's mapped against your unique reference, which is your PIN or your index number. So the system is very much aware of a single ID that has applied for a single slot. So there can't be the option of double selecting facilities.
HR. Yes, I said my name is Osman. I work with Radio Gold. Yes, so I was trying to find out from you, HR, like those who go on the portal to register, whether there's a mechanism that you put in place to ensure that somebody will not register in different regions. For example, in the Upper East region, and the same person doing the same in different regions. Is there anything that you are using to check this? And then second one too is, I don't know if you have a data that tells you the number of professionals that is needed in particular district, where when you put on the portal, maybe those professions, you have allocated more people to that area. Is that one what is there in the system? If not, what are you doing on that? Thank you.
For the district that we're choosing, that one we just benchmarked on the free primary healthcare districts. So that was the one that was used. And that one, those determinations are done already by WHO, by World Bank. So you have those data there already. Those are the ones that they also use for the free primary healthcare selection. And the recruitment is based on that. You know, somebody was asking me, why are you not prioritizing where you went to do the launch? Is it that place what Shy or Sudoku? But it's based on the records that we have, and then the numbers. Then someone also asked about the early payment. That is the reason why you were unable to do the 16,000 that minister have been talking about. For us, you decided that we will not employ people for them to stay home and work, and then they will not be paid. So if you realize the doctors one that we did last year, those who started in November, they received their salary in November. So the very month they started, they received their salary. So this one, we are starting from July. I can say that in July, those who report early, they will get their salary. So that's the way that we are going. We are not going to allow anyone to work and they will not be paid. Thank you very much.
I think actually, but when I work for Kesben Media, of course, the bone of contention here is the no slot syndrome. And we've engaged some of the health professionals, and what they say, some of them are of the view that the portal was a mere formality, and even selection were made beforehand. That is the perception some of them have now. So I want to ask what the ministry is doing to prove, if they have a mechanism to prove that whatever they did was merit-based, so that perception could be cleared, and also the approach the ministry would want to use so that we will not encounter any of such issues in the next cycle of selection.
Regions outside Accra, when we started the northern regions, majority of the applications were from the northern regions. At a point, I was even asking why we are getting the IPs. When I asked them that they should trace the IPs for me to know where they are coming from, majority of them were outside Accra and Kumasi. So in those times, people were actually waiting for the southern side. So majority of the applicants that have received submitted their application in the northern part of the country, they are from the northern part of the country. And I think the whole issue is that people wanted Accra and Kumasi. That was the whole thing. I know Sandra and his group, majority of them, that's what they were looking for. They were waiting for Accra to come. But Accra, the numbers are not much because Accra is already saturated. So we gave few numbers for Accra. That's why it created all those issues.
It means we'll share it here in Accra, and the person in the rural area will still be deprived. Let me tell you how it works. In our villages where we all live, we know when it's time for recruitment, where all of us will go with our laptops and there will be network. So if you go to our portal, what you see there is that you see the countdowns. There will be a countdown up to the last minute. What that means is that it gives you the opportunity to go to a place where you can have proper network. You see, we didn't want to take anybody by surprise. That is why we started by doing the verification. Verified your PIN first. Just go. Be sure that my PIN is verified by the system. So that the day the portal will be open for recruitment, I will have the opportunity. So those things were done. Those in the villages, if I live in Alakble, I go to Angologan because I don't have I will get it there. If I live in maybe a village around Dwaboso, I'll come to Dwaboso to get it. If I live around, so that is how it is done. That is why I'm saying that maybe they want to cry. So mostly we those from the village, we know where the network is. It's normally under some tree or around some area. We all go there to access network. It's the same thing that happened if I'm applying for police, if I'm applying for military, immigration. It's through the portal. It is not shared like you are sharing cake. No. Thank you.
Staffing number, what it means is that the meaning of staffing number is that we have predetermined gaps already at the ministry, and all agencies also have that. This particular recruitment, we took the needs assessment from the agencies specifically, but nationally, I also have the staffing norm of the whole country. So I know that this is the number of nurses they need, this is the number of doctors they need. So anytime you are doing recruitment, this is what we use to determine the numbers, and that's what we are working towards to achieve. You understand? So any recruitment that we do, we don't just do it in vacuum. We use the needs assessment and the requirements. Every year, these requirements are used to prepare budgets. And it's out of that budget that you are getting this financial clearance from. So the financial clearance that you are getting is against the Ministry of Health budget, which we have determined before the year starts. So that's how it works. So all the areas and then the numbers that we need, we know them. So for instance, if you look at the community health nurses, as we speak, for us to have the full number for the free primary health care, we need maximum 12,000. Minimum, you need 6,000. And that's the reason why this time we emphasize on community health nurses. Because the numbers that we have, we need extra 6,000. And this recruitment, we are not going to get even up to 3,000. So that's the reason why we are also considering the voluntary system to add up to it. You understand? The voluntary system, if you go to some countries, they don't use the health professional. They use local people to do it. But for us, we realize that since we also have professionals also at home and they are not working, why don't you use them rather to go and now pick somebody who doesn't have any idea in health care delivery to come and do those work? So that
my name is Benadamo. I'm the Greater Accra Regional Rep for Graduate Unemployed Nurses and Midwife Association. My question is about the fact that in the past years there's been issues of nurses being recruited and then posted to their various hospitals. They work for close to a year and then they are not paid. So I'm trying to understand that, is it going to be an issue this time around, or should we expect that as they do their work at the hospitals, they're going to be paid duly and not to be delayed? Also, we understand the fact that this recruitment was based on the issues of deprived areas needing more health professionals at their various hospitals. But then I also want to get a clarification on how these districts were chosen as deprived, because looking at some regions have a lower number of health facilities than places like Greater Accra and Ashanti region. So are we going to consider the fact that these places have more hospitals, like I made mention of Greater Accra region and Ashanti region? Because if we are only choosing places that they are deprived and then they need these, when you do the ratio and proportion, you understand that Greater Accra and Ashanti region even need more health workers, to the best of my knowledge. So I want to get a clarification on that. Thank you very much.
The truth is that when we began this whole process, various hackers went onto the portal trying to mimic what we're doing. You know the obvious reason, so that they can collect money from people. They created an account that looks like what we were using. And quickly, you remember the first day, we shut it down and brought it back. Then quickly, they released theirs to say that this is a clone account we're using. It wasn't our site. We don't have any reason to have a separate account to recruit people. The processes you have seen is just transparent. If us here in the ministry is not able to help anybody, it means that the slot was put in there for outsiders to get. We have nothing to hide in this process. I'm sure the continuous statement, the continuous release of press releases should tell you how transparent this thing has been. I didn't want to add what was happening in the past. In the past, these numbers, you won't even hear it anywhere. You won't see any press release on 8,000 that we are going to recruit 8,000. What you see is that it will just be shared among people and then that's all. But because we have decided to be transparent about this system, that is why you would hear about this no slot issue. The no slot you mentioned, if you look at the number of people who go on the site within 5 minutes, you definitely have traffic issues. You will definitely have traffic issues. So if I am smarter than you and we go onto the portal, I will get before you. Some went there and will be going around the portal, want to see what is there. By the time you will finish that, somebody would have applied and gotten job. We know a lot of people. You said whether we have evidence or not. We posted the evidence on our portal, but later we decided to pull it down because of data protection issues. There are people the nurses, you know your friends, allied health, pharmacists, you know those who went into the portal and got genuine job. I have been sent a lot of screenshots that I've gotten it. I've gotten it. You know them. We have said that if somebody has collected money from you or has helped you to get this recruitment, come and report the person. We've not had anybody. Some will post, come and report just a person who has collected your money or the person who has also paid the money. We don't have. I'm sure these ones are ghosts who are collecting the money and we don't have them. It's a transparent system. Thank you.